I am going to teach you a 60-second test right now that neurologists use to identify people at high risk of dementia, years before any symptom appears. This test requires no equipment, no doctor, no lab, just your body in 60 seconds. I have been practicing neurology for 22 years, and this single test predicts dementia risk more accurately than most blood markers currently available. Yet almost no senior has ever heard of it. By the end of this video, you will know how to perform it, what your result means, and exactly what to do based on what you find. Are you ready? Stay with me. This 60 seconds could change everything. Before the test, you need to understand why it works. The test is called the single leg stance test, and its connection to dementia risk comes from a specific area of neuroscience that most people have never heard of. Your ability to balance on one leg depends on three systems working together simultaneously: your vestibular system in your inner ear, your proprioceptive system, nerve feedback from your muscles and joints, and your cerebellum and prefrontal cortex, the brain regions responsible for coordination, executive function, and cognitive processing. Here's the critical connection: the same brain regions that control balance, particularly the prefrontal cortex and the white matter pathways connecting it to the cerebellum, are among the first areas damaged by the small vessel disease and neurodegeneration that underlies both vascular dementia and Alzheimer's disease. A landmark study published in Stroke, one of the most respected neurology journals in the world, examined over 1,300 adults with an average age of 67. Every participant performed the single leg stance test. Researchers then performed brain MRI scans on all participants. The results were striking. Adults who could not hold the single leg stance for 20 seconds were significantly more likely to have silent cerebral small vessel disease, microscopic brain damage invisible on standard clinical assessment, and reduced total brain volume compared to those who could balance for 20 seconds or longer. A second study, published in the British Journal of Sports Medicine, followed 1,702 adults aged 51 to 75 for 7 years. At the start of the study, every participant performed the single leg stance test. Adults who could not hold the balance for 10 seconds had an 84% higher risk of dying from any cause within the follow-up period compared to those who could. Not 10% higher, not 20% higher, 84%. And a third study from the Journal of Alzheimer's Disease found that declining single-leg balance performance predicted cognitive decline and dementia diagnosis with significant accuracy, particularly in adults over 65, even when standard cognitive tests showed no abnormality. Why? Because balance decline and cognitive decline share the same underlying brain pathology. They are two expressions of the same disease process. And balance declines first, years before cognitive symptoms appear, giving you a window to act. Now let me walk you through exactly how to perform the test correctly. Setup: stand near a wall or sturdy chair with one hand available for safety, but do not hold on. You need to attempt freestanding. Wear flat shoes or no shoes. Stand on a hard floor, not carpet, which gives additional balance assistance. The test: stand with both feet together. Fix your gaze on a single point directly in front of you at eye level. A spot on the wall works perfectly, keeping your eyes open and fixed on that point. Slowly lift one foot off the floor. Bend the raised knee to approximately 45 degrees so your raised foot is near the ankle of your standing leg. The moment your raised foot leaves the floor, start counting seconds in your head, or ask someone with you to time you on their phone. Hold the position without touching down, without hopping, without grabbing support, and without moving your standing foot. When you touch down, stop counting. That is your score. Do each leg separately. Your weaker side is your true score. Rest for 60 seconds between legs. One important safety note: perform this test with a wall or chair within arm's reach. Do not perform it in an open space where a fall could cause injury. Safety first, always. Now let me tell you what your number means: 20 seconds or more, both legs. This is the target for adults over 65. Holding 20 seconds or longer on each leg indicates good neuromuscular integration and is associated with significantly lower dementia and cardiovascular mortality risk. This does not mean you have zero risk, but your balance system is functioning at a protective level, 10 to 19 seconds. This range indicates moderate balance decline. The Stroke Journal study found that adults in this range showed a significantly higher rate of silent brain lesions on MRI. You are not in immediate danger, but this result is a clear signal to begin targeted balance training and to discuss cardiovascular and cognitive risk factors with your physician. Less than 10 seconds. This is the result that requires immediate attention. The British Journal of Sports Medicine study found that inability to hold 10 seconds was associated with 84% higher all-cause mortality risk. Adults in this range should discuss this result with their physician at their earliest opportunity. request brain health screening, cardiovascular risk assessment, and a structured balance rehabilitation program. Unable to lift foot at all without grabbing support. This indicates severe balance dysfunction that requires urgent physician evaluation and physiotherapy referral. Do not delay. Your result is not a verdict. It is information, and information allows action. If you scored 20 seconds or more, maintain your balance system with daily single leg practice. Stand on each leg for 30 seconds daily while brushing your teeth or doing kitchen tasks. This keeps your score high and your brain connection strong. If you scored 10 to 19 seconds, begin daily targeted balance training immediately. Single leg stance practice twice daily. 30 seconds each leg, each session. Within 6 to 8 weeks, most adults in this range see measurable improvement. Also ask your physician for a cardiovascular risk assessment and blood work, including blood pressure, blood sugar, and cholesterol, as these are the primary modifiable drivers of the small vessel brain disease that your score suggests may be beginning. If you scored under 10 seconds, speak with your physician this week. Request a formal balance assessment, a cognitive screening using the MOCA test I described in my dementia signs video, brain protective blood work, and a referral to physiotherapy for structured balance rehabilitation. Also begin the dietary changes I described in my brain, shrinking food video, reducing ultra-processed food and adding fatty fish, blueberries, and olive oil. These changes directly address the inflammatory and vascular mechanisms driving your balance decline. If you could not lift your foot, physician appointment this week, not next month, this week. Regardless of your score, the most powerful intervention available to you right now is daily physical activity that challenges your balance and cardiovascular system simultaneously. The 5-minute workout I described in a previous video, particularly the single leg stance exercise, directly trains the neuromuscular pathways that this test measures. 4 steps, starting right now. Action step 1, perform the test today. Right now, after this video if possible. Stand near a wall, lift 1 foot, count, record your number, both legs. Write it down with today's date. Action step 2, retest every 30 days. Track your number. Improvement is possible and common with consistent daily balance practice. Decline over time is a signal that requires physician discussion. Action step 3, based on your score, take the action I described. 20 seconds or more, maintain daily. 10 to 19, start daily training and physician discussion. Under 10, physician this week and begin rehabilitation immediately. Action step 4, share this video with every senior in your life today, because this test takes 60 seconds. And 60 seconds of awareness could give someone years of earlier intervention. Dementia does not announce itself. It arrives quietly, after years of silent changes that were always detectable but never looked for. The single leg stance test is a 60-second window into those silent changes, a number that tells you where your brain is right now and how much time you may have to change its trajectory. Your number is not your destiny. Balance can be trained. Brain health can be protected. Vascular risk factors can be managed. And the earlier you start, the more meaningful the difference. Perform the test. Know your number. Take your action. Subscribe for more senior-specific, clinically grounded health information every week. Hit the like button if you are going to perform this test today. And leave a comment with your score. I want to know how you did. Thank you for watching. Stand strong. Your brain depends on it.